Hi, I'm Dr. Abby Waldman. I'm a Mohs surgeon and dermatologist at Brigham and Women's Hospital. So the First Lady, Jill Biden, recently underwent a procedure called Mohs surgery for a type of skin cancer called basal cell carcinoma. And she had one of these above her eye and as well as on her chest. And so here's what you need to know about basal cell carcinoma and Mohs surgery. So basal cell carcinoma is a very common type of skin cancer, especially if you have pale skin, blue eyes, a family history of skin cancer, or significant sun exposure, especially when you were younger. So the good news is that basal cell carcinoma rarely goes inside the body or to the lymph nodes or anything scary like that. But if you leave it, it will grow and destroy the tissue around it. And so it's very important to treat these lesions, especially when they're small. Mohs surgery is a type of surgery that is used to remove skin cancers such as basal cell when they arise on the head and neck and on functional areas like the hands and the feet. Mohs surgery allows for same-day clear margins, an excellent cure rate with about 1% cure rate for basal cell carcinoma, and oftentimes a smaller stitch line. During the procedure, we numb up the area of skin with a local anesthetic, cut around and underneath, and then go check the margins in the lab. During the procedure, we numb up the area with a local anesthetic. The Mohs surgeons, such as myself, will cut around the tumor and underneath, and then take that tissue into the lab to process. That process takes anywhere from 20 minutes to even over an hour, depending on how large the specimen is. And so expect for a lot of wait time. Usually you'll have a bandage. You can either wait in the waiting room or in the room and bring a good book and some food and maybe a friend. If there's more cancer left behind, then we have a map that allows us to go back and take that cancer and leave the normal cells behind. Every time we go back, it does add some time to the clock, so expect for it to be a long day. At the end of the procedure, expect to have a line of sutures, a scar line. That is going to be a different shape and length depending on the location of the defect. While initially the stitch line is going to look long and puffy and a little red and look like it is never going to look normal again, you have to trust that it is. Over the next few weeks to months, it's going to flatten out and just fade away into your background skin. Now, once you've had one skin cancer, the chances of getting another skin cancer in the future are much higher. So you want to make sure to follow up with your dermatologist at least twice a year for basal cell, and maybe even more often depending on other skin cancers you've had in the past. You're going to want to check your own skin regularly. Any pimple that hasn't gone away in 6 to 8 weeks, is bleeding, painful, new, you want to bring those to the attention of your dermatologist. And to avoid further sun damage, it's important to apply sunscreen with at least 30 SPF every 2 hours, to wear a wide-brimmed hat, sun protective clothing, and try to stay out of the sun between 10 a.m. and 2 p.m. when the sun is at its strongest.